Hey, for those of you who are going to watch this, this is a real neat opportunity I had as I was thinking about some additional ways to honor our nurses. And I know last week was Nurses Week. In fact, I know our governor has made some comments about maybe we should have Nurses Month. And so as I was thinking about that, I was thinking maybe there'll be a unique way for us to do some things in, which is very different from us, a Zoom recorded meeting to ask some of our leaders across our healthcare system, what do nurses mean to you? And I'll set up a little bit of the question. I'll ask each of the individuals, and I'll introduce them here in a second. I've had a privilege. I've been in healthcare now for, it's hard to believe, and I probably shouldn't admit, about 32 years. And I've had the privilege all throughout that time to work with nurses and to see the incredible work that they do every day in taking care of our patients and caring about people. Really somewhat, I believe, the heart of healthcare. In fact, I've got two sisters, and both of them are nurses. So I've had a lot of time around nurses, and they're very, very special to me. But what I want to do here for a few minutes, and I'll introduce each of them. Dr. Bill Campbell's here, and he is one of our surgeons. He's primarily at Park West. He is with Premier. He's also one of our board members. And then I have Miss Debbi Honey here, who's the chief nursing officer of the health system. Chris Greenwood, who is a nurse manager at Regional. Aundrea Mills, who's the CNO at our hospital in Morristown, and then Brittany Cox, who's a staff nurse at our hospital in Roane. And what I'm going to do is I'm going to call on each of them, but here's the question I would like you to answer from your perspective. And there are really two questions. The first one is maybe what do you appreciate most about nurses? And then the second question is what makes a great nurse? So if you don't mind, Dr. Campbell, I'm going to call on you first. Obviously,
Okay.
in addition, you work with nurses in a very unique way, and maybe just kind of give us some of your thoughts on that.
Well, I guess what I would say about appreciating nurses is that I can't do my job without a nurse. I can't care for my patients. I can make some decisions and do a few things, but everything that we want to have happen depends on the nursing care that's around us. They're an extension of our hands and our decision making. They really make the patient experience much more so than the doctor does, in my opinion. They provide communication between myself and the patient, myself and the patient's families, between myself and other specialists. They more than anything just give more than anything for the patient, I think they give a level of comfort. They can help the patient through a difficult experience. Probably more than anything for me, they can efficiently and properly execute things that, protocols and plans and orders that need to be done to make sure the patient is safe and well taken care of. So I would guess that would be a few of the things that I would say I appreciate about nurses, is that they make it possible for me to do my job.
Wonderful. What makes a great nurse from your perspective?
A nurse has all kinds of facets. There's lots of things that go into nursing. I appreciate nurses as you said. You have family members. I have family members. As a matter of fact, I have two daughters that are nurses. I think the nurse has to be all things to all people, and that's all. Nothing else. They need to be compassionate. They need to be empathetic, but they also need to be disciplined and highly efficient. They need to have a good font of medical knowledge, but they have to be able to, hold hands and communicate. Really, probably communication as much as anything. All the while, they have to be IT and medical technology experts. So there's a lot of angles, but I would say empathy, communication, and just discipline to try to do the right thing, to care about the safety and well-being of the patient, even when things get, as they almost always do, somewhere in the course of a day, frustrating and seemingly overwhelming. They've got to be able to keep their head. So those are a few things.
Dr. Campbell, thank you. Those are awesome answers, and obviously from a physician's perspective, and I hope the nurses who have a chance to listen to this just know from a physician's perspective how important you are to us. And I have heard along the way, occasionally nurses are IT experts when they're helping the physicians. And so I want to call now on Debbi Honey. Debbi Honey is the Chief Nursing Officer of Covenant. She is a nurse. so she understands a little bit about them. But Debbi, would you mind kind of walking through maybe first, what do you appreciate most about nurses?
Well, the first thing I appreciate, Jim, is the caring spirit. I mean, nurses, as a nurse, and my colleagues on the phone on this call, nursing is not a job. Nursing is a vocation that we are called to do. And the majority of us love, to Dr. Campbell's point, when we get frustrated, we come back the next day. It is about taking care of our patients. And also what I appreciate is what Dr. Campbell also said is around that conduit. We are kind of the translator and the glue that puts everything together for a patient and their family when they are scared, when they are in a strange environment and they don't know what to expect. And nursing is that empathetic voice that helps advocate for them.
That's awesome. And then maybe second part of the question, what makes a great nurse?
I'm going to take the compassion word and scale it back a little bit. It's about the passion for the work. I've always wanted to be a nurse my entire life. From age 6, I knew I was going to be a nurse. And it is about that passion that takes, you get excited about how you can help patients every day. We also, have to, I like to have a lot of variety. So we have to be very adaptable as nurses because we don't know what's behind the next door. And also, again, being the advocate for our patients and families to make sure that they are safe, they have a good experience, and we do understand, what their needs are. And then lastly, I would say nursing is lifelong learning. If I did practices as I was taught in my diploma school of nursing a few years back and applied it today, I would be so out of practice. So it really is about learning and being that clinical expert in your specialty.
Very good. Thank you. Chris Greenwood, who's nurse manager at Regional. Why don't you answer the first question? What do you appreciate most about nurses?
I think one of the big things is the resiliency and self-sacrifice. I think with all the COVID pandemic, everything that's going on, I think that's really been more front and center than it ever has been before, at least in my life anyway. And you think about there's very few professions that you can do to make such an impact on people's lives. Every day we have the privilege and the opportunity to really write a chapter in our patients' lives and their families' lives. And really, if you think about it, it's an amazing thing. It's really hard to put words to it, but it's just an amazing thing.
That's awesome. What about what might make a great nurse? What makes, in your experience, what makes a great nurse?
Yeah, I think a lot of what Dr. Campbell and Debbi's already said, of course, goes without saying, be strong clinically, solid skill set, excellent communication, good relationship with the physicians. But even more, to go with what Debbi said, it's a calling and it is a passion. You can teach anybody the technical skills. You can teach that to anybody, but you can't really teach the true empathy and compassion and the passion, as Debbi said. A great nurse, they walk side by side with the patients and the families. And, a great nurse is the patient's biggest advocate and cheerleader. So it's, to me, that's what makes a great nurse.
Wonderful. Thank you, Chris. Aundrea Mills, I want to ask you some of the same questions. What do you appreciate most about nurses?
I think definitely, Jim, the selflessness and strength that I see with my nurses, and of course being a nurse myself for 20 years, I think sometimes there's strength when maybe there's nothing left, and they keep going. And it's that tenacity and that dedication that keeps them coming back. And I see you smiling. And it's calling, it truly is. And Debbi, you referenced that. And Chris, you referenced the COVID-19. And I think the public spotlight it just showed who we are and always have been and will continue to be. But it's definitely the selflessness and strength that I appreciate the most.
That's awesome. What about, from your experience, what makes a great nurse?
Somebody just alluded to, the clinical skills. Chris, I think you did. I look at resumes and much like the patient, we expect that. We know that they're going to come to us with a skill mix, but when I see that fire in their eyes and they're interviewing and that passion for what they do, what makes a great nurse is just that. They've answered that calling, and they're here to show up every day tirelessly to be the hands and feet of God.
That's awesome. Last but absolutely not least is Brittany Cox. Brittany is one of our staff nurses who works in our hospital at Roane, and would love to hear, Brittany, from you. And you can answer this however you want. You can answer, what do you appreciate most about nurses? What do you appreciate most about being a nurse? Why do you love being a nurse? Answer kind of how you want as a staff nurse.
Okay. Aundrea stole my word, tenacity. I feel like as a nurse, we are always going and giving and, jumping in when necessary, and we give and we give and we give when we're here. And then when we go home, we give in our personal life. And I think that not very many professions, people would continuously do what we do and still say that they love their job or that they want to go back. So I think the tenacity of a nurse is what really is probably my favorite quality. And to, we can say that we can meet all the criteria in a job description or on a resume because we all go to school. We should all know those things. We're all taught those things. But there's, that tenacity, that passion, that can't be taught. You're born with it. Some people aren't born with it either, but they find that they have such a passion for caring for people that's something that is really honorable about a nurse, I believe.
Wonderful. How about in your experience working alongside other nurses, what makes for a great nurse?
Everybody has talked about what makes a great nurse. So I agree with everything that everyone said. The thing about nursing, I think that really can set you apart and make you an excellent nurse is to realize your part in the team. I think that it takes a whole group of people to take care of a patient the way that they need to be taken care of. And as we want to be the person that everybody needs us to be, sometimes we can't. And that's okay. We have to learn our spot in that patient's life and in their care. Because, you might take a report from a nurse that had a really good shift with the patient and, they were able to make them smile or laugh or relieve their pain. And then you have a shift with the patient and you don't really hit all those same milestones. But it's important to appreciate that the other nurses are going to be different in some way than you are. And I think also it's not just with nursing, it's with the pharmacist, with the doctor, with the therapist, with the case managers, with the housekeeper. I think when a nurse can really understand their role with their teammate, that they will be able to be a better nurse and to be an excellent nurse.
Wonderful.
Because we all do have, the compassion and the drive and the knowledge to be there and to take care of the patient.
Yeah. That's awesome. To be a great nurse, you got to be a great teammate, right?
Mm-hmm. Yeah.
So I want to tell everybody thank you for being willing to be interviewed on this call. I want to tell everybody who's willing to watch this video segment once we post it, just thank you. Thank you for the nurses and the hard work you do every day. While on one hand, COVID-19 is highlighted across our nation, a lot of the work of nurses, the truth is that's the work nurses do every day. And those who have been in healthcare long know that. I won't forget several weeks ago when COVID-19 was first starting, I was out at Park West and I went to one of the first units that was created specifically for COVID-19 patients. And this was at the time that we weren't getting lab results back for 7 to 10 days. So you were having to take care of those patients for pretty much their whole stay as if they had it. And I remember going down that hall and talking to some of the nurses. All these nurses had volunteered. They had raised their hand and said, we want to be the ones to take care of those patients. And so while this has been a unique time through COVID-19, the reality is the work nurses do every day is so important. In my experience, nurses are smart, and being smart is so important. Being inquisitive, being, like Debbi said, a constant learner is such an important thing. But the nurses that have always set themselves apart from me, they had all those qualities, but they had heart. They really, really care. And you can be really smart, but if you don't care about people, you'll never be a great nurse. And so I just want to say to all those, again, who are watching this, all the nurses across Covenant Health in an inpatient, outpatient setting, we as a team that's on this call want to tell you thank you so much for what you do. You're appreciated, and you're very, very special to us.